Do you know about the female pelvis? I mean, the bones which are present in the female pelvis. What are the diameters and what are the importance of a female pelvis diameter during the pregnancy and the birth when she is giving birth of a baby? Hi, I'm Ankita Sen. Welcome to my channel that is Nursing Sensation. In today's video, I'm going to discuss about details of maternal pelvis. When you are showing a maternal pelvis for your practical exam or anywhere you are demonstrating, you should always hold it in an anatomical position. But here, as because I'm starting the video, I'm holding the pelvis a little bit up in my chest level, which should not be actually, but just showing you in the introductions, I'm showing this in a little bit uppering positions. So, the maternal pelvis or the female pelvis is generally gynecoid in type, and the pelvic brim, that is the pelvic brim, which is round in shape. And the structurally, anteriorly it is formed by the symphysis pubis, posteriorly it falls by the sacrum and the coccyx, laterally it falls by the hip bone. And this hip bones again formed by three bones, that is ilium, ischium and the pubis. So ilium is the superior flat bones which is present in the hip bone. Ischium is the posterior and the inferior rough bones which is present in the lower part, and pubis, there is two pubic bones which is present anteriorly. So this is generally a divisions of a maternal or the female pelvis. So today I'm going to discuss about in a very details about the maternal pelvis. In today's video, I'm going to discuss with you regarding the bones present in the female pelvis, the joints present in the female pelvis, the ligaments which are present in the female pelvis, and the important thing, that is the diameters, which are very important in the relationship with the fetus during the labor in the female pelvis. As I have told you, there are two hip bones, and the hip bones are formed by three bones, that is ilium, ischium and pubis. So first here I'll discuss about the ilium. So ilium is formed by the flat part which present in the superior aspects. The superior border is formed by the iliac crest. So this is the iliac crest of the ilium, which ends at the blunt end, which is known as a anterior superior iliac spine, and just below of this there is anterior inferior iliac spine. Posteriorly, the iliac crest ends in the posterior superior iliac spine, which again continue and ends with the posterior inferior iliac spine. And after this posterior inferior iliac spine, you can see there is a notch at the posterior, which is known as a greatest sciatic notch, which is having a very important clinical significance, that through this greatest sciatic notch, the greatest nerve of our body, that is sciatic nerve, which is getting passes through. At posterior, there is a rough surface you can see here in a both side. Here is a rough surface and here is another rough surface, which is known as a iliac tuberosity, which gives attachment to the various muscles, In the anterior or the medial surface is formed by the depressed portion. This is the depressed portion you can see, okay, which is known as the iliac fossa. This iliac fossa, anteriorly, there is a arcuate line which letters joined with the iliopectineal lines, which is an important landmark for a pelvic brim. Medially, it's articulate with the sacrum. It means the iliac fossa or the iliac is articulate with the sacrum and forms the sacroiliac joint. You can see in both sides there is two sacroiliac joint here, which is movable. Here is one, here is another one. And the ilium has again two parts. The superior part is from the ala. So this is known as the superior part of the ilium, which forms the ala, And the inferior part, this portion, is known as a body which attached with the ischium. So this body is attached with the ischium. So in ilium, I have discussed with the iliac crest, the anterior superior iliac spine, anterior inferior iliac spine, in the posterior superior iliac spine, posterior inferior iliac spine. Then there is a notch which is known as a sciatic notch, which is having the importance because through which the sciatic notch passes through. Then I have discussed about the iliac tuberosity in the posterior part. In the anterior part, there are depressed part which is known as the iliac fossa. And this iliac fossa again attached with the sacrum and forms both sides the sacroiliac joint. And here is a acute line which having the importance later on in the iliopectineal lines as a iliopectineal lines. And here is a two part in the ilia. The upper part is known as the ala, and the lower or the inferior part is known as here the body which attached with the ischium. So this is in a very gist about the ilium. Now come to the second bone, that is ischium. So this ischium has got two parts. Through this ischium we can sit properly. Okay, so this through this the ischium we can sit properly. So ischium have two parts. First one is the body of the ischium. This is the body of ischium, which is, you can see, very rough part. Okay, and this is the ischial tuberosity, which is again a very rough part. When we are sitting on the ischial tuberosity. We are sitting like this. You can see, you can feel here, that is the ischial tuberosity. Anterior to this ischial tuberosity, there is ramus, and this ramus and this pubic bones joins together and form the obturator foramen, which covers by the obturator membranes through which the blood vessels and the nerves are passes through. So this is the obturator foramen. This is the junction of a pubic bone and the ramus. So posterior to ischium, you can see here, this is the ischium from posterior part. You can see this. Posterior to ischium, one projection is present. You can see the projection. Here is one projection, here is the another projection. So this projection is known as the ischial spine. This has a very clinical significance. That is, it helps to understand the station of the head during the labor. So I have discussed with you about the ilium and the ischium. Now the third bone is the pubic bone. So anterior hip bone is formed by the pubic bone. So here you can see these two are the pubic bone which is presently anteriorly. And this pubic bone, this small bones, again has got three parts. That is the superior ramus, the inferior ramus, and the body. So here is the superior ramus, the inferior ramus, and the body, which is present in the both sides. The body where the two ramus, like the superior and inferior, gets meet together. Okay, the anterior border of pubic bone is known as pubic crest. So this is pubic crest. So this is the anterior border of the pubic bone. Lateral to this, there is present the pubic tubercles. These all are having very clinical significance for the landmark of the pelvic brim. So this is pubic crest. Lateral to this is pubic tubercles. From pubic tubercles, our lines run through posteriorly or laterally, which is known as a pectineal line. You can see, so this is the pectineal line, which latter merge with the arcuate line. So I have told you in the ilium, there is a arcuate line in the anterior portion. So this pectineal line, which comes posteriorly and comes and merged with the arcuate line here and forms the iliopectineal line. So this is pectineal line, this is iliopectineal line. Together, three bones, that is hip bones like ilium, ischium, and pubis, is formed here. You can see a cup or a socket-like structure here, which is known as acetabulum, where the head of femur is getting attached. The head of femur is getting attached in the acetabulum, and which helps us to move our joints, hip joints. Okay. So, dear listeners, here I have discussed with you about the three bones, that is ilium, the superior flat part, the ischium, that is the inferior and the posterior part through which we can sit easily. Okay, and the pubic bones which present anteriorly. Now, come to the posterior aspects of pelvic brim, which is a part of skeletal system. If you imagine like this, as I'm holding this skeleton, this pelvis in anatomical structure. So, if you just assume that this is the skeletal system or the skeletal structure in my body, so you can see posterior of this pelvic bone is formed by the sacrum. So, this is sacrum. So, sacrum is having one base here, which is a very flat part, and apex where it's get fused with the coccyx, okay, in the down. So the sacrum is triangular in shape, you can see this, or wedge in shape, and consists of 5 fused vertebrae. The upper border of the first sacrum vertebra, which projects forwards or anteriorly, this upper border of first sacrum vertebra, which is known as the sacral promontory. Anterior surface of sacrum is very curved. You can see here, this is very curved or concave in shape, which is known as a hollow of the sacrum. Posteriorly, there are two articular surfaces which attach with the lumbar. So here you can see there are two articulating surface area which are attached with the lumbar and forms the lumbosacral joint. So this is lumbar upside and this is sacrum. So it joins with the lumbar and the sacrum. So and form the lumbosacral joints. Laterally, there are two articular shape structure which extends laterally. You can see here there are some extend structure laterally from the sacrum promontory, from sacral promontory, which is extend laterally, is known as a ala of sacrum. This is ala of sacrum in a both side. Anteriorly, there are 4 transverse lines. Here you can see 1, 2, 3, and 4. So there are 4 transverse lines present anteriorly and is showing the fusion of the vertebral bodies of the sacrum. At the end, there are 4 pair of anterior foraminus, that is 1, 2, 3, 4. This is the anterior foraminus. Again, which is continue with the posterior foramina. You can see 1, 2, 3, and 4. Okay, so there are foraminus. Actually, this should be a whole, but each company is having another structure or shape to make the pelvis. So here you can't see the hole here, but generally there should be some hole because this anterior foraminus and the posterior foraminus through which the blood vessels, the nerves should be enter or exit. So ideally there should be hole in this structure which is known as the foraminus, anterior and posterior. At the lower part of sacrum, there is a opening. So this is sacrum. At the lower part of the sacrum, there is one opening which is known as a sacral hiatus. So this is the apex. I have told you in the sacrum first. So this is the base of the sacrum and this is the apex of the sacrum, the lower part. So if you turn the apex like from the posterior part, you can see in the apex of the sacrum there is one opening which is known as the sacral hiatus. There are the projections which helps the ligaments to connect with the coccyx. So you can see one projection is here, another projection is here. 2 projections are here above this hiatus, sacral hiatus, which helps the ligaments to connect with the coccyx. Coccyx is present here. Now come to the after sacrum coccyx. So coccyx is a fusion of 4 vertebrae. We all know that anatomically it's a fusion of a 4 vertebrae. This coccyx, it is attached with the sacrum in the upper part and forms sacrococcygeal joint. It has a base here and an apex here. So this is the base of coccyx and this is the apex of coccyx. This coccyx, as because there is a joint, sacrococcygeal joint. So this is very flexible in human female and is directed inferiorly. Okay, if you hold like this, you can see the coccyx is here, and this is flexible in females and is directed inferiorly so that the fetus can easily pass through the birth canal. So when it's just move, as it is flexible, if it is moved posteriorly, okay, so the fetus is getting more space here and the fetus can passes through the birth canal easily. Okay, in a posterior aspects, there are two projections. You can see there are two projections which is known as coccygeal cornua, which attach with the ligament of sacrum. So this two projections, coccygeal cornua, helps the coccyx to joint with the sacrum. So this is all about the coccyx. So here I have discussed about the bones, that is hip bones, the sacrum and the coccyx. Now come to the next part, that is the joints present in the maternal pelvis. So there are four joints. Joints means where two or more bones are meet together. So first talk about the symphysis pubis. We all know this is symphysis pubis, and this is one joint, and this is the joint between two pubic bone. So there is two pubic bone which attach together as a form of symphysis pubis, which is one in number. Next come to the sacroiliac joints. I have already told you. So this is by name you can easily understand between the sacrum and the iliac. So sacroiliac joints, which is present in a both side. So this is two in number. And this bone is the strongest bone of our body, which articulate the sacrum and the ilium in both sides. Now comes to the sacrococcygeal joint. The name again denotes this is the joints between the sacrum and the coccyx, known as a sacrococcygeal joint, which is one in number and which is very flexible in women and provides a room in the pelvic outlet so that the fetus can easily pass through this. So there are four bones: symphysis pubis 1, sacroiliac joints 2, third one is sacrococcygeal joint, which is one in number. Now come to the third part, that is the ligaments present in the female pelvis. So there are total 8 ligaments present in the female pelvis. So what is ligaments? Ligaments are the structure which holds the joints together. Okay, it helps to hold the joints together. Now, first talk about the interpubic ligament. So the name denotes that it is present between two pubic bones and joins together. Okay, that is interpubic ligaments between two pubic bones. And this is, you can see easily, this is fibrocartilaginous in structure. You can see this is a very soft one. Okay, so this is fibrocartilaginous in structure, which is one in number, intrapubic ligament. Second one is sacroiliac ligament. So the name is denoting that it is present between the sacrum and the iliac joint. So it helps to hold the joint together, that is the sacroiliac joint. So it is present two in number, anterior and posterior, both sides. So here it is in the right side and the left side, both sides the sacroiliac ligaments are present anteriorly and again posteriorly to hold the sacroiliac joint together. So this is sacroiliac ligaments, two in number. Now come to the third one, that is sacrococcygeal ligaments. So this is a ligament which hold the sacrococcygeal joint. So the name is denotes the sacrococcygeal ligaments. Again, it is present anteriorly and posteriorly for both sides to hold the joints together. It is also one in number. The fourth one is the sacrotuberous ligament, which is again two in number. So the sacrotuberous ligaments, by the name you can understand, it is present between the sacrum and the ischial tuberosity. So both sides you can see from sacrum to ischial tuberosity like this. One ligament is coming in the right and another ligament is coming to the left side. So both ligaments are present in both sides. So there are two sacrotuberous ligaments. And come to the fifth one, that is sacrospinous ligament. This is again two in number. So you can see from the sacrum up to the ischial spine, this type of one ligaments will come. You can see this like this. You can see this from the sacrum to the ischial spine. In one side, one ligament, and in another side, one ligament. So this is 2 in number, and this is known as a sacrospinous ligament. Generally, there is a very limited movement in between the joints in a non-pregnant state. But at the time of pregnancy, there are so many hormones that are get released from the body, and that causes the softening of the ligaments. As a result, we can see the diameter of the pelvis is getting increased as the ligaments are very it is getting soft by the help of hormones, and these ligaments hold the joints, so it helps to move the joints more easily. So it's giving the increasing the diameter of the pelvis, which again easily help the fetus to easily pass through, to accommodate first and easily pass through the birth canal. Now, come to the pelvis. There are 2 pelvis again, that is the false pelvis and the true pelvis. So the name denotes the false pelvis. It is not pelvis, but name as a false pelvis. So this false pelvis is shallow and basin in shape. So you can see, if you see this pelvis like this, so this is structure is almost basin in shape, shallow and basin in shape, okay, and it is lie above the brim. I have already told you this is the pelvic brim. This upper part you can see, this is the pelvic brim. So lies the false pelvis above this pelvic brim is known as a false pelvis, and this is not having any exact pelvic measurement. So false pelvis have some boundaries. Posteriorly, we know this is sacrum. So if you think this is the lumbar vertebra, so posteriorly the false pelvis is having the lumbar vertebra, laterally is having iliac crest and the iliac fossa. So this is the iliac crest and this is iliac fossa, which is laterally present in the false pelvis, and anteriorly it bounded by the anterior abdominal wall. So there is anteriorly abdominal wall, laterally there is iliac crest and the iliac fossa, and posteriorly there is a lumbar vertebra in the false pelvis. It gives supports the uterus during the pregnancy, but it's not having any obstetrical importance. This is all about the false pelvis. Now come to the true pelvis. This true pelvis, the name is denotes that there is pelvis and there is diameters, as the pelvis is a bony part having some ligaments and joints. Definitely is showing that it has some exact pelvic measurement. And this true pelvis having 3 parts again. First one is pelvic brim, which you can see, known as a inlet also. Then the inside, this part is known as a cavity, which is round in shape. And the last one is the outlet. The name is denotes that it is the outer part of the pelvis, and this is the outlet. Now I'll discuss with you regarding the pelvic inlet. So the pelvic inlet is the area where the fetus come first and contact with the maternal pelvis. So if you assume this is a fetus skull, then you can easily understand when the baby is getting engaged. So it's first touches the maternal pelvic inlet, okay, and there is various bones, which bony points, which is known as a landmarks of the pelvic inlet. So these are the bony projections on the landmarks in the pelvic inlet, which is 9 in number. So if I start the landmarks from anterior to posterior, then it can be significance like this. First one, the upper inner border of symphysis pubis, pubic crest, pubic tubercles, pectineal line, iliopectineal eminence, iliopectineal line, sacroiliac joint, ala of sacrum, and sacral promontory. So, I have already introduced sacral promontory to you beforehand, ala of sacrum beforehand, sacroiliac joint beforehand, iliopectineal line beforehand, pectineal line beforehand, and pubic tubercles and pubic crest also beforehand. So here the 2 new landmark you came to know, that is the upper inner border of symphysis pubis and the iliopectineal eminence. So let me tell you again the landmarks in a very short. upper inner border of symphysis pubis, pubic crest, pubic tubercles, pectoral line, iliopectoral eminence, iliopectoral line, sacroiliac joint, ala of sacrum, and sacral promontory. And these all are present in a both side. Okay, so this is the 9 landmarks of a pelvic inlet. Now come to the pelvic cavity. So the cavity extends from the brim above because the brim is present, and in the below the obstetrical outlet. The anterior wall of the pelvic cavity is formed by the pubic bones and symphysis pubis. As because this is the cavity, the inner part. So before of this, I mean the anterior aspects of this, you can easily understand there are two pubic bones and the symphysis pubis, and the depth of is 4 centimeter. The posterior wall of the pelvic cavity is formed by the curve of sacrum. So this is the sacrum. So the curve of sacrum, which is known as a hollow of sacrum. I told you beforehand also, this is known as a hollow of sacrum, which is concave in shape. So posterior wall of the pelvic cavity is formed by the curve of sacrum and 12 centimeter in length. So the cavity is round in shape. As it is round in shape, so the diameters of pelvic cavity is same anterior, posterior, and the transverse also, and the diameters is 12 centimeter. Now come to the pelvic outlet. To show the pelvic outlet, you have to turn the pelvis like this. So there are two outlets described in the pelvic outlet. One is anatomical outlet and second one is obstetrical outlet. So what do you mean by anatomical outlet? Anatomical outlet, it forms by the lower border of each bone. You can see the lower border of each bone ends together definitely, and the sacrotuberous ligaments. Okay, so this is the sacrotuberous ligaments. I told you beforehand also, sacrotuberous ligaments here from sacrum to here. So this is the anatomical outlet. So the all lower part or the end part of each bones end with the sacrotuberous ligaments. So this is the anatomical outlet. What do you mean by obstetrical outlet? So this is having the greater practical significance as because it includes the narrow pelvis straight through which the fetus passes mostly. So this is the obstetrical outlet which is having the greatest clinical significance. I will discuss regarding the anatomical outlet and the obstetrical outlet in details further. So now come to the fourth and the most excited part of a female pelvis, that is the diameters of the pelvis, which is really having clinical significance during the pregnancy and the especially during the labor, when the mother is giving the bearing down effort and the baby is passes through the birth canal. So it's having the clinical significance during the labor especially. Okay, so there are three parts like pelvic brim, pelvic cavity, and the pelvic outlet. So first I'll talk about the diameters of the pelvic brim. You all know that this is the pelvic brim. So pelvic brim is having three diameter: anteroposterior diameter, transverse diameter, and oblique diameter. So again, in anteroposterior diameter, there are three diameters. First one is known as true conjugate or anatomical conjugate, which is 11 centimeter in diameter. So this is started from this is the sacral promontory. So remember, for the pelvic brim, any anteroposterior diameter will start from the sacral promontory, midpoint of sacral promontory, and ends with any part of the symphysis pubis. Okay, so upper one, middle, and the lower one. Like this, we will discuss. Okay, so to easily remember, you have to understand that the diameter of pelvic brim, anteroposterior diameter of pelvic brim will start from the midpoint of the sacral promontory for each one and will ends with the symphysis pubis. Okay, so first, two conjugate and the anatomical conjugate, which is 11 centimeter in diameter. So this is starting from the midpoint of the sacral promontory to the inner upper border of symphysis pubis. Okay, so this is the inner and the upper border of symphysis. You can see this is the inner border and the upper border of symphysis pubis. Okay, so this is from the midpoint of the sacral promontory to the inner upper border of symphysis pubis, which is known as a true conjugate or anatomical conjugate, which is 11 centimeter in diameter. Now come to the obstetrics conjugate, which is 10 centimeter in diameter. Again, from the midpoint of sacral promontory, it goes to the midline on the inner surface of symphysis pubis. So here you can see this is the middle part of the symphysis pubis, middle inner part. Okay. So again, you have to point the pencil or your indicator at the midpoint of sacral promontory. Don't move this one. Okay. And place this end to the midpoint on the inner surface of the symphysis pubis. This is 10 centimeter in diameter, which represents this obstetrical conjugate represents the available space for the passage of the fetus. Okay. Next come to the diagonal conjugate, or which is 12 centimeter. And this diagonal conjugate, as you can see in the picture, this is the only measurable conjugate. And now from the midpoint of sacral promontory, the lower border of the symphysis pubis, you can see from the midpoint of sacral promontory, the lower inner border of the symphysis pubis, this is the length. Okay, this is 12 centimeter in diameter. So there are 3 anteroposterior diameter in pelvic brim, true conjugate or the anatomical conjugate, then the obstetric conjugate, and the diagonal conjugate. Okay, 3 part we'll discuss, like the inner upper border, the first one. Second one is the inner middle border, okay, surface, and the third one is the lower inner border of the symphysis pubis. So like that, you can easily show the 3 anteroposterior diameter of the pelvic brim. Now come to the transverse diameter of the maternal pelvis, which is 13 centimeter and which is the largest centimeter or the largest diameter in the pelvic brim. The distance between 2 farthest point of iliopectineal line is the transverse diameter, which is 13 centimeter, where the engagement of the baby's head occurs. Okay, transversely. You can see this. Okay, so this is the transverse diameter. Now come to the oblique diameter of the pelvic brim. So in the brim, there are 2 oblique diameter and the diameter is 12 centimeter. Each one extend from one side of sacroiliac joint to the opposite side of iliopectineal eminence. You can see this is the eminence. Okay, so starting from the sacroiliac joint to the opposite side of the iliopectineal eminence, this is known as the oblique diameter of the pelvic brim, which is 12 centimeter. And as I have told you, there is 2, because if it is start from the right side, it's known as a right oblique diameter. If it is start from the left side, it is known as a left oblique diameter. Okay, so the right or the left, it denotes the sacroiliac joints from which it starts. Now come to the sacrocotyloid diameter, which is generally is not discussed, but I want to discuss with you because you have to know the details of the pelvis. That's why. So this sacrocotyloid diameter is 9.5 centimeter, which again an oblique diameter. So this is important in case of flat pelvis. So this is the distance between the midpoint of sacral promontory to the iliopectineal eminence. This is 9.5 centimeter, okay? This one, okay? And it represents the space occupied by the biparatal diameter of the head while it's negotiating at the brim in the flat pelvis, okay? So this is the importance of it. So here I have discussed about the diameters of the pelvic brim. That is anteroposterior diameter. There are 3 diameters in anteroposterior. There are oblique diameter. There are 2 clinically significant in oblique diameter, and the subcorticoid is important in case of flat pelvis, and the transverse diameter in the pelvic brim. Now come to the cavity. As I have told you, the cavity is a segment of pelvis bounded above by the inlet and below by the plane of least pelvic dimensions. Okay, and this is generally round in shape, and the diameter, anteroposterior diameter is 12 centimeter. And the transverse diameter also 12 centimeter. As because it is round in shape, so in any angle you if you measure, the diameter is same, that is 12 centimeter. But still, to understand you in a better way, the anterior-posterior diameter of the pelvic brim will start from the posterior surface of symphysis pubis to the, we can see here, second and the third sacral vertebra. Okay, so this is the sacrum. So second and the third of sacral vertebra to the midpoint of the posterior surface of symphysis pubis. So this is the anterior surface of symphysis pubis. This is the posterior surface of symphysis pubis. So this is known as the anterior posterior diameter in the pelvic brim, which is 12 centimeter. Okay, and must remember, this is the most roomy plane of the pelvis. That's why it's also known as a plane of greatest pelvic dimensions. Please, I am repeating you, note that plane of greatest pelvic dimension. Okay, that is the anterior posterior diameter of the cavity, that is 12 centimeter. Now come to the transverse diameter of the pelvic cavity, which is 12 centimeter again, but it can't be precisely measured as because most of the points in the transverse diameter of the cavity lies on the soft tissues. Okay. Now come to the diameters of the pelvic outlet. So as I told you previously also, there are two outlets, that is obstetrical outlet or the obstetrical conjugate and the anatomical outlet or the true conjugate or the anatomical conjugate. Okay, so first discuss with the obstetrical outlet or the obstetrical conjugate, which is a narrow pelvis plane, also known as a plane of least pelvic dimensions. Just now I have told you about the greatest pelvic dimensions. Now I am telling you this obstetrical outlet is also known as a narrow pelvis plane and also known as a plane of the least pelvis dimensions. Okay. So it is the segment of the pelvis bounded above by the plane of least pelvis dimensions and below by the anatomical outlet. I have already discussed about the anatomical outlet, the boundaries of the anatomical outlet, that is the every lower points of the every bony parts and the with the sacrotuberous ligament. So this is the anatomical outlet from sacrum to the iliac tuberosity. So there are two ligaments. So this is the anatomical outlet here. So how you can measure the obstetrical outlet? With the help of anatomical outlet. So above the obstetrical outlet abovely by present with the plane of least pelvis dimensions and below by the anatomical outlet. So there are three dimensions in the obstetrical outlet or the obstetrical conjugate. First one is the transverse. So if you place like this, you can see the transverse diameters of the pelvic outlet, which is 10.5 centimeter. So this is the ischial spine. So the distance between the two ischial spine is known as, you can see this. Can you see this? This is the dimension, okay, between two ischial spine. So this is 10.5 centimeter. This is the transverse diameter of the pelvic outlet. Now come to the anterior posterior diameter of the pelvic outlet. That is from the tip of the sacrum is extend to the inferior border of the symphysis pubis. So I have told you this is the apex or the tip of the sacrum. Okay, so from the tip of the sacrum it extend to the inferior border, the lower border, okay, the inferior border of the symphysis pubis. So this is this one, okay. So tip of sacrum to the inferior border of the symphysis pubis, which is 11 centimeter anterior posterior diameter of the outlet, okay, pelvic outlet. Now come to the posterior sagittal dimensions, which is 5 centimeter. So this is the distance between the sacrum and the midpoint of the symphysis bispinous diameter. So I have told you this is a bispinous diameter, right? Okay, which is a transverse diameter of the outlet. So if you imagine the middle point of this and the dimensions from the tip of sacrum to this. So this is the tip of sacrum here, okay, the tip of sacrum. So from here, the imaginary line between the midpoint of bispinous diameter is known as a posterior sagittal diameters, which is 5 centimeter. Okay. Now this obstetrical outlet is having the obstetrical significance also. What are the two obstetrical significance? First one, very important. That is, as because it's having, you can see the ischial spine here. So I already told you this ischial spine denotes or indicates the station of the head. So if the baby's head is coming to the level of ischial spine, this is known as a station 0. When it is above the ischial spine, it is known as a minus, like minus station. And if it is crosses the ischial spine, is known as the plus station. I mean the baby's head is going down. Its descent is occur very nicely. But the level of ischial spine, if the head is present, it is denotes the station is 0. This is the one clinical significance. And another is, it is the plane where the internal rotation of the fetal head occurs during the labor. Okay, there is an internal rotation of the fetal head occurs during the labor. So these are the two obstetrical significance of the obstetrical outlet or the obstetrical conjugate in the pelvic outlet. The anatomical outlet or the true conjugate or the anatomical conjugate, whatever you can say, it is a bony outlet. It is bounded in front by the lower border of the symphysis pubis here, and laterally by the iliopubic rami. Here is the rami, I have told you already. Okay, and then ischial tuberosity. Here the ischial tuberosity and the sacrotuberous ligament, which are present from the sacrum to the ischial tuberosity. So this is the plane which is known as an anatomical outlet. Okay. Again, I'm repeating very shortly. In front of the anatomical outlet, in front there are lower border of the symphysis pubis, and laterally there is ischiopubic rami. Here, ischiopubic rami, ischial tuberosity, and the sacrotuberous ligament. Okay, posteriorly by the tip of coccyx here. Posteriorly by the tip of coccyx. Okay, this is the apex or the tip of coccyx. So this is known as the anatomical outlet or the true conjugate. Okay, and now come to the diameters of this. Again, this is having two diameters: anterior-posterior diameter, which is 13 centimeter, and transverse diameter, which is 11 centimeter. Now, the anterior-posterior diameter, how you can show this? The diameter is start from the tip of coccyx to the lower border of the symphysis pubis. So like this. If you hold like this, so you can see easily from here to here. Okay. So this is the distance. Okay. This is the distance. Okay. And this is 13 centimeter. But this 13 centimeter, we can get it during the second stage of labor. Generally, in normal position, it measures about 2.5 centimeter less. I mean 10.5 centimeter. But during labor, the diameter is increased and comes to the 13 centimeter. Why? Because I have told you, remember, this coccyx is a flexible joint. So during labor, it is getting in a back like this with the position change of a woman. So when it is getting back from the tip of coccyx up to the lower border of symphysis pubis is getting, you can see the diameter like this. If it is like this in a normal position, the diameter is very less, 10.5 centimeter, okay? But when the woman changing her position during the labor, so it goes back, okay? With the position changing, and the diameter is increasing 2.5 centimeter and is come to the 13 centimeter anteroposterior diameter of the anatomical conjugate, which is very, very important for the baby when the baby is coming out from the maternal birth canal. Okay. Now come to the transverse diameter of the anatomical conjugate, that is 11 centimeter. That is known as a intertuberous. Okay. Between two inner border of ischial tuberosity. So we know that this is ischial tuberosity. Okay. So between the inner border, so this is the inner border of the ischial tuberosity, this is ischial tuberosity, and this is the inner border of the ischial tuberosity. So the distance between the two inner border of ischial tuberosity is known as transverse diameter or the intertuberous diameter of anatomical outlet, which is 11 centimeter. So this is all about the diameters of the outlet. So outlet having, there are two outlet, obstetrical outlet, which is having 3 diameter, that is the transverse diameter between two ischial spine, 10.5 centimeter. Anteroposterior diameter, which is again tip of sacrum to the inferior border of symphysis pubis, 11 centimeter. And posterior sagittal between the tip of sacrum to the midpoint of the bispinous diameter, which is known as 5 centimeter. And this obstetrical conjugate having clinical significance for the to understand the station of the fetal head, and it helps to internal rotation of the fetal head. Okay. Now come to the anatomical outlet. Anatomical outlet, also known as a true conjugate or the anatomical conjugate, and having two diameters, that is anterior posterior diameter, which is 13 centimeter, tip of coccyx to the lower border of symphysis pubis, which is 10.5 centimeter generally, but during labor, when a female is changing her position, the coccyx is going back and the diameter is increasing almost 2.5 centimeter and comes to 13 centimeter. Okay. And the transverse diameter between the two inner border of ischial tuberosity, also known as intertuberous diameter or the transverse diameter of the anatomical outlet, that is 11 centimeter. Hopefully, I explained the all diameters in a very easy way to remember for your practical exam or competitive exam. So this is all about the bones, joints and the ligaments and the diameters of a female pelvis. If you find this video was helpful for you, please give us a thumbs up, share, subscribe, and don't forget to press the bell icon. Thank you.